When you're massaging someone else, try not to do it for more than an hour. Right now, I'll use the next few minutes to show you again the way I massage. I'll go over it very quickly. Start at the solar plexus, to the adrenal gland, to the kidney, to the urethra, to the bladder. You can use the second joint of your index finger to massage these zones. To massage the thyroid gland, you can do it this way, to apply more pressure onto it 3 to 4 times. The reflex zones for the neck, brainstem or cerebellum, the left trigeminal nerve, and the frontal sinuses. They can all be massaged by using the tip of one or both thumbs. Now, we move to the zones for the pituitary, to the head, onto the eye, and the left ear. Now, if the skin is too thick in this area, you can use the second joint of your index finger to massage. This is the occipital nerve. If one gets headaches or a sore neck, this is the area to be massaged. Now we move on to the trapezoid musculature. Make sure you press hard in this area. Next is the zone for the lung and the bronchi. Use the first joint of your thumb to exert more pressure. Now the stomach, the duodenum and the spleen. You can find the liver and the gallbladder on your right foot, and this is a very sensitive area. When massaging this area, make sure you use the second joint of your index finger in order to cover the entire area. Now, if this hurts the patient, you can massage gently with the tip of your thumb. My patient's face is quite red. That's an indication that the blood circulation has increased. Now, let's look at the entire zone for the digestive system. The way to massage this area is to use the second joint of your index finger. If you can feel that there's deposits while massaging, that means that you can treat this area for a longer period of time. For someone who has chronic digestive problems, this is also the area that one should pay more attention to. Now do it the way I'm doing it. Then gently massage the whole area. The patient will feel very good after this. We now move on to the zone for the sciatic nerve and the genital glands. This is also the area to be massaged if one has problems sleeping at night. Don't forget the coccyx as well. All right, now let us look at the inside, the reflex zones on the inner side of the foot. Firstly, we use this method to massage this area. The area is very sensitive. Next is the zone for the parathyroid gland, cervical vertebrae, then the nose, next the thoracic vertebrae, the lumbar vertebrae, the hip joint, the sacrum, and the inner coccyx. Now, since my patient is very sensitive in this area, I'm going to massage it with less pressure. For men, this is the zone for the prostate gland. For women, it's the uterus. Where I'm pointing to now is part of the zone for the ribs. I'm now massaging with both hands on the reflex zones of the upper and lower lymph glands. This is the most effective way to massage this area. When massaging this zone, you do not need to apply too much pressure, since you want to let the patient relax a bit after an hour-long treatment. Another method to massage is to make one stroke hard and the other stroke soft when massaging the lymph glands. However, if it still hurts, then all the strokes should be soft, and just a few times would be enough. If someone has a cold, or maybe a sore throat, then you must massage the area softly and count 1, 2, 3. Then rub the area gently. The patient will feel much better. Let us now review the reflex zones on the top of the big toe. It starts from the upper jaw, to the lower jaw, to the tonsils, to the vocal cords, to the esophagus, to the trachea, to the sternal lymph glands. Now massage this area using all 4 fingers in an upward motion. Count to 3, and then rub the area gently afterwards. Next to the reflex zone for the eye. And for the balance organs. If someone works too hard, he may have neurasthenia. A clear indication of that is if the person has tinnitus, a ringing sound in the ears. When someone has problems in the chest or breast area, when massaging this zone, you may also feel that there are deposits in it. Next, the reflex zones on the outer side of the right foot. We start with the shoulder. A bit below it, you'll feel a bone sticking out. That's the elbow. And across on the other side is the diaphragm zone. After the elbow zone is the point for the knees. This is a very sensitive area. We then move on to the zone for the ribs. If you have back pains, then this is the area to work on. Press hard on this spot, count 3, and then rub it gently afterwards. Now this is the reflex zone for the hip joint area. If somebody's been sitting down too long or has not been sitting properly, they'll probably have problems in this area. We now move on to the zones for the genital glands. That is the testicles for men and ovaries for women. Then to the outer coccyx. And we now massage the sciatic nerve, like this. Count 1, 2, 3, and then rub it gently and press 2 more times, and that will be enough. We do the same on the inner side of the right lower leg. 1, 2, 3. This patient will be feeling much better now, and he'll feel stronger as well.